Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to every Wednesday here from the Jahangir Wellness Center. My name is Kavas Jahangir, and today I've got the boss of the Jahangir Wellness Center. I've got Dipali Rajpal here, who is finally on the show. Thank you so much for being here, Dipali. It's been long overdue.
Thank you so much for having me in the show. It's my privilege to be here.
Absolutely. And before we get started, I have to tell you in this public space that you've been doing a fantastic job since the JWC started. We've been getting great reviews since we've opened this center, and what you've been doing is fantastic. So thank you, and
Thank you so
thank you, and
much.
then we look forward to hearing your insights and hopefully some fun stories about the center. So again, thank you so much for being here.
Thank you.
So I will ask you straight in because, as I said, you're the head of the wellness center and you've been seeing thousands and thousands of people come here now, coming through our doors. Let me ask you, what does wellness mean to you then?
To me, wellness means how we feel about our life and about ourselves, and also includes the overall quality of life. It
Yeah.
includes factors such as physical health, your overall social connections, and also a sense of purpose.
Right. A
Like-
sense of purpose. That's a good one. Not a lot of
Yeah.
people talk about that. Yeah.
Yes. So one who is having a goal in life definitely is very motivated and resilient. And even the study shows like one who is having a goal lives longer, have a robust immune system,
Right.
and a better cognitive health.
Okay. Well, what's your goal in life, man?
My goal as a wellness head here is to give a compassionate care and a quality service to all whoever coming here and heal them holistically.
Yeah, that's a good answer. Hopefully, we want to keep trying to do that as we go along.
Yeah.
But as I said earlier, we've got thousands of people that have been coming here now through our doors for their health checks, for their wellness packages, for various therapies that they've been doing. What are the most common perceptions or misperceptions that people have, or misconceived perceptions that people may have when they come through these doors? Stereotypes that they may feel that we need to get rid of that fear, or any kind of stories or anything like that that you see that comes through?
Yes, there are many. Like the people who are coming for the checkups, they come with a hesitation of doing certain tests.
Yeah.
Maybe because they are painful. Like for mammography, women are saying like it's so painful. No, I won't do that thing.
Okay.
Also for the pap smear, yes, it's invasive, means a painful procedure. So people think, no, we don't want to do that. But I will always make them understand, like since it's a painful procedure, but it takes only a few minutes to do it. But it helps you to screen for any further diseases in your
Yeah. It's worth
life
it for the long term.
for the long term.
Right.
Yeah. So such kind of things are always there, and also many people thinks like we are doing fit. We are fit.
Or we
are
look
doing-
fit, or we
we look fit. We are hitting gym on a daily basis. Why would I need to go for a preventive health checkup?
Exactly. Yeah.
Yeah. So one has to also think on the same time, like if you're hitting gym on a daily basis, you're working your heart muscle much more than a normal person.
Yeah.
When did you last did your health checkup? When did you last did your heart muscles? When did you last check your electrical impulses of the heart? And
Which is what we do over here with the stress test.
Stress
and other
test
kind
and
of thing.
echo.
That's the one where you're walking or running on the treadmill,
yes,
right?
yes. So we have to do that on a yearly basis, and also many people do just the blood test.
Yeah.
And if the blood test comes out normal, they feel like we are fit.
Great,
We
yeah.
don't want to do the extensive health checkup. But there is no blood test which will find out the heart electrical impulses. There is no blood test which will find out the lung function
Yeah.
capacity. So you have to have the comprehensive health checkup done, the whole body screening done.
So everything from head to toe is what we do here.
Yes. So that we need to take care of,
Yeah.
along with the mental health as well.
Right.
And many times, like the strength and the flexibility, we always ignore until and unless it's gone. So this thing also needs to be taken care along with your this thing, preventive health checkups.
Okay. And that's so important that what you're saying. Oh, the point that you mentioned is that someone might look fit or they feel fit, but you don't know what's going on
Inside the
under the
body.
table or whatever you want to call inside the body.
Yeah.
So it's extremely important that even if you are fit, it's actually as important to be looking at, your full health check, so to speak.
Yes.
And then, of course, all the allied services that we offer here beyond just the simple health check of, head to toe scans.
Yes.
What are some of the popular therapies that we offer here just beyond the health check that people have been happy with and taking part in?
Okay. So people are happy with the Bowen therapy.
Okay.
Yeah, it's a new technique from Australia.
Okay.
It's a soft tissue manipulation technique, which is helpful for basic ailments like for the gastric issues.
And it's non-invasive. It's like
Non-invasive,
you're
it's just a
basically
soft
touching
tissue rolling. It's
muscles,
there.
rolling muscles.
So people enjoy that.
Right.
Even it helps for the relaxation as well.
Okay.
So Bowen therapy is there.
Mm.
Then chakra meditation, which helps you to connected to the spiritually.
Right.
So chakra meditation people enjoy here. Yeah.
Okay.
So
And there's a fair amount of technology that's also coming into
Yeah.
use in the wellness space, and that's also, I think, aspects that
yes.
we are and you are definitely something advocating that needs to be incorporated and more as we go along. So that's
Yes.
also areas that we looking at as well.
Correct. So we for that, like for finding out the emotional status, we are having a Emoscape test, which will find out the emotional status of that person.
How does that work roughly?
It's based on AI model. So it will give you a prompt of what positive, negative thoughts are coming in, and it find out the status emotionally.
Okay. And people have been using that.
Yeah,
As
people
it's part of their wellness check.
Yeah.
Wow, that's quite cool.
Yeah.
And very interesting. What's your favorite therapy here?
My favorite therapy here is like Bowen. I used to take
Yeah.
it whenever I am having a basic
Stressful
and
day.
stressful day, or if any pain in the body after a day. I enjoy that.
Yeah.
Yeah,
That's the perks of working in a wellness center. You
Yes, definitely.
at the end of the day, get a massage from a Bowen therapist.
Yes.
You can do some physiotherapy. You can do yoga. You can do dance.
Correct.
Heart therapy.
And also like a drum circle is very...
Oh wow, we do. Yeah, that's right. We've had drum circles here.
Yes.
It can be loud. Does that disturb the neighbors?
No.
We should disturb the neighbors.
Correct.
That's very interesting. So, coming back to wellness, I mean, now everyone is talking wellness. Everyone talks about wellness retreats and so forth. But what we're trying to do is really the true holistic sense of wellness, of not just health checks, but as we talked about these art therapies, music therapies, mindfulness,
Yeah.
well-being, and so forth. What are some areas that you think are still untapped that we can get into,
Yeah.
or that people would like to see?
Yeah, so basically, like we are doing the preventive health checkups here. At a wellness center, we analyzes the individual as a whole,
Yeah.
including their mental health. So mental health is a thing which people are not that aware, I would say.
Right.
They are still not want to bring it forward
Yeah.
to the... It's a taboo, yes. So at an wellness center, we always promote to have individual. We analyze individual as a whole.
Right.
See, early 1990s,
Okay.
if I talk about,
Yeah.
there are majority of deaths are due to infectious diseases, I would say, or communicable diseases.
Right.
Because of improvement in sanitation, access to healthcare and nutrition, this deaths due to infectious diseases has drastically come down. And earlier it was 25% of diseases are from the non-communicable or lifestyle
Yeah.
diseases.
Which is like diabetes,
Diabetes,
heart,
heart diseases, like that.
pressure, right?
In 2019, it was found that 65% of deaths are due to non-communicable diseases.
That's a big.
Big transitional shift in that.
Yeah.
So at wellness, we are doing the preventive health checkup. We are tackling the intangibles. And also, like we are giving the holistic kind of a service.
Yeah.
We are promoting the mental health. We are taking care of their mental health as well, their spiritual health as well, their
Right,
emotional
right,
health
right,
as well.
absolutely.
And analyze all these things, all the data, and heal the person holistically.
We're giving everyone pathways
Pathways to...
for their wellness.
Correct.
Right. Absolutely. So, coming back to the preventive side, actually, have you noticed that someone who comes for their health check for the first time and discover something, or may not discover something, but they find value in that, and then because of that, they start coming back every
Yes.
6 months or every 1 year just to keep
Yes.
a check. So, you think that's always that once they do it once,
Yeah.
then they realize the value of it and start coming back.
Yes, certainly. There are many.
Hmm.
Actually, some of the other disease, when it creeps, we never know
Yeah.
because it's all intangible.
Yeah.
We come to know only when it manifests, which I told.
Right.
So even it happened with my mother-in-law as well. She
Okay.
used to do the blood test. She used to
Yeah,
do
yeah.
certain tests. When she did the complete test, the diabetes had come up.
I see.
Yeah. So now it's a regular routine for her as well to do the checkup.
And it keeps her in check now
Yeah,
without it being out of control.
out of control. So it happens with many.
Right.
When they come to know they came here and then certain diseases or certain symptoms have arrived
Yeah, yeah.
because of that. So
Okay. Well, of course, you're the head over here, so you see a lot of people. You get to see a lot of people's early detection, maybe not detection, just people staying healthy, wanting to try becoming healthier.
yeah.
What do you do for your wellness?
For my wellness, in my daily routine, I do meditation like 10 minutes daily in morning.
Oh, really? Every day? That's very good.
Yeah, every day. And for my wellness, I have a daughter with me. So spending time with her, it's a quality time with her. It's kind of a wellness for me.
Right. What kind of exercise? Oh, you said meditation.
Meditation and walking. Yeah, walking.
Okay.
Just walking, not going to gym every day like
Right,
that.
right. Well, you're walking through the center every day, so
Yeah.
that's also walking.
Correct.
Any last words you'd like to leave us with, Dipali?
Yeah, so I want to leave a message to each and everyone to get the preventive health checkup done every year.
Right.
Come here to Wellness. We are here to help you out holistically, and we are there for you.
Yeah, thank you for the reminder because I'm due for mine actually. So I'll be coming soon and hopefully you'll be there to help me through the blood tests.
Correct.
Because that's one thing that I'm, along with the people that we spoke about, are afraid of. So hopefully we'll be able to navigate that.
Yeah.
Thank you very much, Dipali, for everything that you do and thank you for being here.
Thank you. Thank you so much.
Thank you all. See you next week for another episode. And please remember that before you leave to hit the like and subscribe button right at the bottom over here. Thank you.